Congratulations! You are one of the few people making fitness and exercise a priority in your life. Unfortunately, you may never be taught how to exercise correctly. Poor technique, lack of body awareness, and being sold on the latest exercise craze can prevent you from achieving your goals, or worse, lead to pain and injury. What you're about to learn will change all of that. Stop exercising until you see this.
As a physical therapist, educator, and fitness professional, I've been to hundreds of gyms, only to discover that the majority of people exercising are not exercising correctly. The problem is that we never formally learn how to exercise correctly. It appears as easy as starting some routine you learned from a friend, found on television, in a magazine, or on the internet. Creating a healthy body is the end result. How you achieve those results and remain injury-free starts with correct technique. When exercise is performed correctly, your body has a positive response. When performed incorrectly, your body breaks down. Exercising correctly is the secret to preventing injury and becoming fit. Remember, exercise is not good for you. The right exercise is good for you. Now, wouldn't it be nice if someone taught you the right way to exercise? Here it is.
After watching this video, you will understand the fundamentals of exercising correctly, learn to achieve total body posture and how to maintain it during exercise, learn the 3-step exercise technique and its application in an exercise setting that will reduce your risk of injury and get you long-lasting results.
Before we even begin exercising, let's review some essential concepts that will set the stage for your success.
There are simply 2 types of consciousness in an exercise setting. They are repetition consciousness and body consciousness. Remember, your goal in exercise is to avoid injury and to improve your health, not to count repetition. Repetition consciousness is the awareness of the masses. It is simply achieving a certain number of repetitions regardless of how you get there. For example, counting to 10 while lifting weights. Achieving fitness goals with this mindset will be short-lived. Body consciousness is a higher level of awareness. In body consciousness, you are focused on the correct completion of the exercise by placing your attention on the signs of your body. You finish an exercise after your body tells you, not at a specific repetition. After all, if you want to create a healthier body, you have to pay attention to the signs of your body. As you fatigue with exercise, your body will display particular warning signs. To avoid injury, you will need to consider either resting or correcting them immediately. The first warning sign is losing your posture. For example, you may slump over, arch your back, or round and hike your shoulders. The second is using momentum. This includes flinging weights or increasing speeds that cause uncoordinated and unsafe movement. Finally, you may begin feeling pain or an excessive amount of strain. The normal signs that your body is being exercised safely are muscle fatigue and light shaking.
Now that you understand body consciousness, you'll need to know the correct posture to use with exercise. Maintaining your posture with exercise is the key to preventing injury and getting healthy results. Poor posture increases your risk of injury, while correct posture reduces your risk. But have you ever been taught the correct posture to use with exercise? Here it is.
Mastering correct posture requires you to adjust 3 main zones of your body. Zone 1 is your lower body. Zone 2 is your pelvis and back, also known as your core. And finally, Zone 3 are your shoulders and neck. Zone 1 includes your feet, knees, and hips. The tips of your feet need to be pointing to approximately 12 o'clock. Your knees need to be bent approximately 90 degrees and aligned with your feet and hips. Rolling your hips in and out can help you achieve a symmetrical, balanced lower body. Zone 2 is the core and is made up of your back and pelvis. Zone 2 adjustments are made from controlling your pelvis. First, find the total amount of motion available by tilting your pelvis backward. Now, stick your butt out or tilt your pelvis forward. Finally, tilt your pelvis backwards to find the middle of these two positions, or your balanced core position. Getting this right may take practice, but it is crucial in order to avoid low back pain and potential injury. Zone 3 involves mastering independent movement of your shoulder blades. The shoulder blades move in 4 general directions: up, down, forward, and backward. The most common mistake you'll make in exercise involves your shoulder blades moving up and forward. You may also incorrectly attempt to pull your elbows back past your body to compensate for poor shoulder blade coordination, or push your head forward to accentuate this motion. The correct combination is down and slightly back. Combining these zones creates a total body posture perfect for handling the forces of exercise. Using body consciousness by placing your awareness on Zone 1, moving to Zone 2, and finally to Zone 3 only takes a few moments, but should always be done before starting any exercise. Practice makes perfect.
We will now combine body consciousness and posture into a specific exercise method called the 3-step exercise technique. It's extremely simple, yet crucial in reducing injury and sustaining results. Applying this technique correctly is sure to add to your overall success.
Step 1 is to set the exercise, or prepare the equipment you will be using. Step 2 is to set yourself, or prepare your total body posture for the forces of exercise. Step 3 is exercise and monitor by placing your awareness on the signs of your body as it fatigues and scanning your 3 postural zones for alignment. In Step 1, you have to set the weight, seat, leg bar, grip choice, or any other adjustments for the machine to fit your body. Never risk your safety by incorrectly adjusting your posture just to perform an exercise. In Step 2, once on the machine or once the exercise is prepared, you must align each of your 3 posture zones. Finally, in Step 3, you can begin exercising and monitoring your body. When you see or feel as if your body is displaying warning signs, reset your posture and begin exercising again. At first, your posture will feel awkward and difficult to control. This is because you are now combining exercise with body awareness and a new postural skill. The application of the 3-step exercise technique is essential to prevent injury and get long-lasting results.
Fitness centers are usually divided into several areas. Most people only choose the things they enjoy, but like a successful diet, you need a balanced workout to get long-lasting results. These areas include a weight or resistance training area, a cardiovascular area, and a multi-purpose area for stretching, functional training, or group exercise. Now let's apply what we've learned.
Circuit resistance training is accomplished by using a variety of machines which stem from three basic human movements of pushing, pulling, and lifting. These basic machines are designed to target all your major muscle groups and can be divided into upper and lower body circuit training exercises. Although there are different brands, colors, shapes, and sizes, they all generally fall into these categories. The lower body machines are the leg extension, the leg curl, the leg press, the calf press, hip abduction, and the hip adduction machines. The purpose of the leg extension is to tone and strengthen your thigh or quadriceps muscle at your knee.
Now we'll apply the three-step exercise technique. Step 1 is set the exercise. The seat settings should align the axis of rotation of your knee with the machine's mechanical axis of rotation. The foot bar should rest against the bottom of your shin and not the top of your foot. Finally, the weight needs to be appropriate for your strength and ability. Step 2 is set yourself. Your feet are aligned with your knees and not turned in or out. Your pelvis is in neutral, that is a rotation backward, forward, and then backward to neutral. Your shoulder blades are down and back with your head straight forward. Step 3 is exercise and monitor. There are several body warning signs you're going to want to look out for. First, any kneecap pain or grinding is a sign to stop the exercise completely. Second, as you get tired, you may find yourself speeding up and gaining momentum to move the foot bar. Avoid this by lowering the weight. Third, prevent your knees and hips from falling inward or outward. Avoid full end range of motion as this exposes your kneecaps to stress and possible injury. To perform this exercise correctly, perform a slow controlled movement from 90 degrees to 30 degrees only. Scan your 3 zones to maintain proper alignment. The result should be thigh fatigue and light shaking, but never pain.
The purpose of the leg curl is to tone and strengthen the back of your thigh or the hamstring muscle at your knee.
Now we'll apply the 3-step exercise technique. Step 1, set the machine. The seat settings should align the axis of rotation at your knee with the machine's mechanical axis of rotation. The foot bar should rest just above your heel. Finally, the weight needs to be appropriate for your strength and ability. Step 2 is set yourself. Your feet are aligned with your knees and not turned in or out. Your pelvis is in neutral. Your shoulder blades are down and back with your head straight forward. Step 3 is exercise and monitor. There are several body warning signs you're going to want to look out for. First, make sure the lap bar is snugly against your thigh. Secondly, your knees may tend to roll inward or outward, and it's crucial to maintain proper alignment. Finally, due to the starting position, maintaining spinal neutral is difficult, especially if you have tight hamstrings. To do this exercise correctly, perform a slow, controlled movement from 20 degrees to 90 degrees, avoiding excessive extension or hyperextension at the knee. Scan your 3 body zones to maintain proper alignment. The result should be hamstring fatigue and light shaking, but never pain.
The purpose of the leg press is to tone and strengthen your quadriceps, hamstrings, and glutes in your legs.
Now we'll apply the 3-step exercise technique. Step 1, set the machine. The sled starting position needs to be at a place that allows a 90-degree bend in your knees. The weight needs to be appropriate for your strength and ability. Step 2 is to set yourself. Your feet should be slightly more than shoulder width apart. The higher on the plate your feet are positioned, the more stress through your glutes and hips. The lower your feet are positioned, the more stress through your knees. At no time should your knees extend past your toes. Continue to align zones 2 and 3 before exercising. Step 3 is to exercise and monitor. There are several body warning signs to look out for. First, your knees and hips may either roll inward or outward. Secondly, people often turn their toes out away from the preferred 12 o'clock position. Although slightly turned out is acceptable, avoid abusing this concept. Finally, never let your knees lock out. Always keep complete contact with the sled and never let your heels come up. To perform this exercise correctly, start from a movement of 90 degrees to a position prior to your knees completely locking. Now scan your 3 zones for proper alignment. The result should be lower body fatigue and light shaking, but never pain.
The purpose of the calf press is to tone and strengthen your gastrocnemius, or the calf muscle in the back of your lower leg.
Now we'll apply the 3-step exercise technique. Step 1, set the machine. The sled starting position needs to be at a place that allows approximately 90-degree bend in your knees. The weight needs to be appropriate for your strength and ability. Step 2 is to set yourself. Your feet are aligned with your knees and not turned in or out. Your pelvis is in neutral. Your shoulder blades are down and back with your head straight forward. Now walk your feet to the bottom edge of the platform with your knees extended so that your heels are off the edge. Step 3 is to exercise and monitor. There are several body warning signs you're going to want to look out for. First, your feet may lose their 12 o'clock position and tend to turn in or turn out. People tend to arch their back at the top of the motion. You'll want to avoid this by doing it correctly and keeping your pelvic tilt on. Perform a slow and controlled heel raise. Your knees should maintain their alignment with their feet pointed to 12 o'clock. Scan your 3 zones to maintain proper alignment. The result should be calf fatigue and light shaking, but never pain.
The purpose of the hip adduction machine is to tone and strengthen your adductors, or the muscles of your inner thigh at your hips.
Now we'll apply the 3-step exercise technique. Step 1 is set the exercise. On a side note, getting on and off this machine needs to be done correctly and safely. Never do what I call horseback riding, or planting on one foot and twisting while you throw your other leg over the top of the machine. I suggest sitting first and using your arm to assist swinging your leg safely over the top of the stirrups. First, the weight needs to be appropriate for your strength and ability. These machines usually have much fewer settings. However, it is crucial that the pads make good surface contact with the inner part of your knees. Open the machine stirrups so that you are close to full range of motion without straining your hips or groin. Step 2 is to set yourself. Your feet are pointing forward, aligned with your knees. Your pelvis is in neutral. Your shoulder blades are down and back with your head straight forward. Step 3 is to exercise and monitor. There is really only one